Welcome to Dr. Lotte Science with Soul. I am Dr. Lotte and the host of this podcast. Today, I'm excited to introduce Dr. Connor Boer, who is back on the podcast, to share his knowledge about pediatric functional neurology. Dr. Connor Boer is the director of Neuroactive Spine and Rehab Center in Phoenix, Arizona. Dr. Boer earned his Doctorate of Chiropractic at Palmer College of Chiropractic. While at Palmer, Dr. Boer received many academic honors and was awarded the prestigious Clinical Excellence Award upon graduation. He then went on to receive a Diplomate in Chiropractic Neurology through the American Chiropractic Neurology Board. Dr. Boer is also fellowship trained in the management of childhood developmental disorders through the International Association of Functional Neurology. So welcome, Dr. Boer. It's an honor to have you back on the podcast.
Dr. Lotte, it's always a pleasure talking to you. I'm excited to be back.
So I can't wait. It's just fascinating what the work that you do. And I follow you on Instagram and I'll just love to see all the posts and all the work you're doing with all the kids. Mm-hmm. And it's amazing. And I see parents posting, the progress that their children has made. So let's start from the beginning. What is functional neurology and what led you to study functional neurology?
Absolutely. So I am a chiropractor by trade, went to chiropractic school, and really within the first, I'd say 6 months of chiropractic school, I really got enamored by the whole neurologic aspect of it. So I decided to take a couple classes with some of the really founders of functional neurology. And once you start learning about the brain and how it intertwines with the body, you kind of go down a rabbit hole that it's almost impossible to get out of, because when it comes to neurology, things are always changing. There's always new research that's coming out, and there's always something new to learn. So I found myself picking up the whole neurologic piece of rehabilitation pretty early on in chiropractic school. I've had some pretty phenomenal mentors along the way kind of guide me through this path. And I'm at the point now where we just opened up our clinic around 6 months ago, and things are going awesome down here in Phoenix. So the easiest way to think about functional neurology, a lot of people think it's a technique or it's a protocol that you learn, but really the best way to describe it, it's more of a clinical thought process. So when we're assessing the nervous system, of course, we're looking to see if there's any pathologies. We want to make sure that there's no tumors or bleeds or demyelination, whatever it may be. If that's the case, we'll refer out to a medical neurologist so they can manage it a little bit different of a way. But when we're going through our neurologic exam, after we make sure there's none of those underlying pathologies, we want to observe the actual function of the nervous system. So even if there's not a true pathology, we want to make sure that all parts of the brain are working the best way that they can. So for example, if we're assessing the cerebellum, what may be a positive indication or a positive sign for me may look a little bit different from a functional neurologist compared to a medical neurologist. They're looking more so at the brain in more of a black and white to make sure that nothing is there that's going to kill them or make them have a little bit more of a deeper intervention, when I'm making sure that that part of the brain is functioning the way that it should. Now, if there's dysfunction in certain networks, certain connections in the brain, then that's going to tie over to certain symptomatology that people could face, everything from dizziness to migraines to ADHD to autism to everything kind of along those lines. And that's the cool thing about what we do, is we see a lot of people in our clinic that have kind of been through the ringer. They've gotten tons of different tests run, tons of MRIs, EEGs, and everything comes back normal, but they still don't feel normal. And that's really where we shine, because we're looking at the nervous system in a little different light than a lot of the other healthcare professionals out there.
So I know you work a lot with children. What type of problems do you see in your clinic?
Yeah, so our practice, we do see some adults but I would say the primary focus of our clinic is going to be the pediatric population. So the main population that we work with is pediatric brain injuries. This is gonna be anything from non-fatal drownings to birthing injuries to choking incidents, things along those lines where there's a hypoxic ischemic event. So that's going to be, I would say, around more than half of our practice is going to be those pediatric brain injuries. We also see a lot of developmental delays as well. These include everything from ADHD to autism, dyslexia, anxiety, things along those lines. So we're able to work with a pretty wide variety of patients. And the ability to apply that functional neurologic model gives us a very good roadmap to be able to think of a clinical thought process to apply the proper therapies to the patients at the right time and also in the right capacity. Because a lot of times a lot of practitioners have been asking for certain protocols to use with certain conditions, and unfortunately that will probably never ever be a thing, because if I work with 5 kids with autism, 5 kids with pediatric brain injury, all 5 are going to be different in some respect. And that's something that a lot of people get a little bit confused about, because there's other professions out there where there's more of I don't want to say a cookie cutter protocol, but there's certain protocols that you follow for certain conditions. While there's always going to be certain similarities with working with ADHD, for example, but every kid is going to have somewhat of a different presentation that we're able to kind of figure out from our neurologic exam. And from that exam, we're able to make that personalized plan for that kiddo's brain. So yeah, it's pretty cool. We definitely have an integrative model. So the brain-based approach is absolutely key, but something that I see a lot of people leave out is the whole metabolic or the nutrition side of working with some of these conditions. Because I always tell parents, we could do some of the coolest therapies in the world, but if the brain isn't able to handle it, those therapies aren't going to be able to be maximized the way that they should, as if compared to if there was proper metabolic health that's able to receive and create those pathways in a better capacity. So one thing that we work on with almost every kid that we work with is that whole metabolic piece, looking at diet, looking at supplementation, looking at lifestyle, etc.
I love your cat. He definitely wants to be part of this interview.
Oh my gosh,
oh, it's so sweet.
She loves the camera, huh?
It's like, let me be in this podcast.
Go on. Yep, I knew she would be right here with me.
I can't believe you just kept your concentration as
Yeah,
the
right.
cat walks across your keyboard. A true neurologist, just keep focusing. So when you're working with these kids, what kind of things do you check? I know I see on your Instagram, you check for different kinds of reflexes, and primitive reflexes are still there. Right. There's certain things that you do.
Yeah, so I guess let's start with the pediatric brain injury side of things. So when there's common findings on some radiographic reports that come back with a lot of these hypoxic ischemic events, a lot of times it affects a deep structure in the brain called the basal ganglia. So there's arteries deep inside the brain called the lenticular striate arteries, which is definitely most common for pediatric brain injuries to have damage through there. And that's going to affect some things like in the thalamus, like I said, the basal ganglia. So going into a lot of these presentations, I know similar characteristics that I'll see with most of these kiddos. But with that being said, there's research out there that shows that the MRI findings and radiographic findings don't necessarily dictate prognosis. So some of the kids with the quote unquote worst MRI findings have done absolutely awesome in our practice. And we see kids time and time again after their injuries where their MRI findings are very, very grim. And they have a very poor prognosis from a lot of other healthcare practitioners. And time again, we're able to see these kiddos kind of blow past those expectations, applying some of the principles that we're able to do. So we're looking at a lot of brainstem functions. This is going to incorporate those primitive reflexes. The brainstem really is the foundation of the growth of the nervous system, if you would. So as we're in utero, kind of growing as a baby, the brain grows from the bottom up and is ultimately going to inhibit itself from the top down. So working with a 3-year-old who suffered a non-fatal drowning, what I sometimes tell parents is we're almost going to regrow the child's brain as if they were a baby. So we want to make sure that all of the primitive reflexes emerge. We want to make sure all the primitive reflexes are inhibited. We want to look at all the sensory systems. We want to activate some of those bigger ones, everything from vibration to vestibular input to sound, smell, touch, taste, you name it, we're going to help stimulate it, because the only way that you're going to create new connections in the brain is to use those sensory motor inputs. So every kid's going to look a little bit different, but we're doing a lot of vestibular input because we know the vestibular system is a big driver of the brain. We're doing tons of cerebellar input. We know the cerebellum is a big driver of cortical function, but we're not negating some of the foundational stuff with that as well, with working on brainstem integration, working on core strands, working on tone, etc. And then coming in the back end, where we want to make sure that the metabolic systems are working the way that they should. We want to make sure there's no micronutrient deficiencies. We want to make sure they're taking some of their basic metabolic support health, such as magnesium, omega-3s, things along those lines. But one of the things that we see benefit these kiddos the most is the use of low-level laser therapy. This is something that I've been introduced from day one of learning about functional neurology and the massive clinical implications that it can have with working with all sorts of neurologic patients, everyone from kiddos to people with neurodegenerative diseases. The research that's coming out with low-level laser really is profound. And we're able to use the laser to help metabolically support a lot of these patients, because there's a laundry list of things that the laser is going to be able to help us accomplish. But one of the most basic and important things is going to be supporting the mitochondria, helping with energy production, like ATP. So if the brain isn't having proper energy output, then a lot of the therapies we're doing has the potential to crash people. We're trained to stay well under that metabolic threshold, so there's signs so we don't crash people. But sometimes people that are a little bit more inexperienced with this population find that sometimes doing trivial stimulation could be a little bit too much for these kiddos. And that's why we incorporate a lot of low-level laser therapy with what we do to help support all the therapies that we're going through. So for example, if we're working on like the cerebellum, we'll have the laser over the cerebellum as we're doing cerebellar exercises. If we're working on the parietal lobe, we'll have the laser over the parietal lobe as we're doing sensory stimulation. Now, this becomes absolutely imperative, not only from a support standpoint, but from a rehabilitative standpoint as well, because they've shown that using this laser in proper parameters has helped increase all those neural connections, even as far as increasing actual neuron growth, neurogenesis. So this laser is something that I use with pretty much every single one of my patients. It's something that even outside of the pediatric brain injury world is something that kids with autism, ADHD, a lot of different conditions can benefit from, because of the core foundational principles of benefits that you could get from the laser. And we could talk about laser all day, but it helps decrease inflammation, which is huge. It helps increase something called brain-derived neurotrophic factor, which is something that helps create neuroplasticity. It increases blood flow. It decreases some reactive oxidation. It's something that I think is on the forefront of, or that one day is going to be on the forefront of healthcare, because we are seeing how beneficial it is, and more research is coming out to help us support all the things that we're seeing in clinical practice.
So if a child comes to your clinic and let's say they're having a hard time in school, they're dyslexic.
Okay.
What would happen? Like, what was the first thing that you do, or how do you help them?
Yeah, so the first thing that we're going to do with every one of our patients is take a detailed history, do our whole examination. Now, with dyslexia, there are clues of things of what's happening in the brain, but our examination confirms all the things that we're of the patterns, I guess you could say, that we see. So a lot of times you see in a big picture scheme is more of a left brain issue with dyslexia. So from our exam, we'll see what networks in that left brain are firing good, what networks are firing a little bit weaker. Once we find those weak networks, we're able to do targeted therapy to activate those connections in the brain. Once those connections in the brain are more efficient, then you're going to see symptoms of dyslexia decrease with that as well. So never will I say that I cured dyslexia by any means, because that's simply not what I do, but I work on the neurologic connections that underlie some of those conditions, like dyslexia, to make those skills more efficient. So whenever I work with these kiddos, it's not like I'm sitting across from them reading a book with them, but I am working on those brain pathways, which then makes them be able to read that book that much more efficient. With dyslexia and some of those learning disabilities, I work pretty closely with a couple of different teachers and aides down in different areas in the Valley. And we find that when we co-manage a lot of these cases, the prognosis is going to be that much better. We've experimented with different things of starting with the functional neurologic care first, then following up with the tutoring, with the extra services needed to help with some of the learning disorders. And when we combine the two therapies, we see results increase pretty dramatically.
So when you talk about the networks in the brain, how do you find what is firing and not firing well?
Yeah, so that's all going to be coming from our initial examination. So we're looking at everything from the outer portion of the cerebellum to the middle portion of the cerebellum to the inner portion of the cerebellum, how that's feeding up to the frontal lobe, how the parietal integration is feeding forward to the frontal lobe. We're looking at everything from eye movements to make sure that they're seeing the words correctly, because if their eyes aren't functioning properly, they're not going to be able to read near as well as they possibly can. So we're looking at all the different networks really that intertwine into those quote unquote reading and learning networks of the brain. And we're able to decipher which ones are looking good and which ones are a little bit weaker. So if we see a kid whose cerebellar integration is pretty poor, but their parietal lobe integration is working pretty well, we know we want to focus on a little bit different of a network, because if we increase those connections in the brain that aren't where they should be, I guess you could say, we know that the symptomatology is going to follow after we improve integration in those networks. So the simple thing that we always preach about is the concept of neuroplasticity. That's something that's definitely been a hot term this past decade, but the easiest way of thinking about neuroplasticity is we're creating new and efficient networks in the brain. So think about riding a bike, think about learning a new language, learning an instrument. When you first go to do it, your body and your brain has absolutely no idea how to do those actions. But the more you practice them, the more you do them, the better your brain's going to learn how to do those tasks. So how do you make a bicep stronger? You work out your bicep. How do you make your cerebellum stronger? You work out your cerebellum. How do you make your parietal lobe stronger? You work out your parietal lobe.
It's like exercises for the brain.
Exactly.
So So parents that might be listening now thinking, oh, I have an autistic child, or I have a child with learning disabilities or ADD, ADHD, and they want to learn more, but they might be thinking, well, this exam that you're talking about, how to figure out what the brain is doing, is that going to be scary for my child? What is that exam like? Is it just a physical exam, or do you use computers, or how does that work?
So our exam, it looks definitely a little bit different than a adult neurologic exam, because with a lot of these kiddos, we're not able to have the big fancy gadgets looking at eye movements, doing hardcore EEGs, just because compliance is a little bit decreased compared to most adults. So what I always start out my exams with, I always promise the patient that nothing I'm going to do is going to hurt whatsoever. So we look at just our basic overall physical exam. So we want to check heart rate, blood pressure. We want to check the reflexes. We want to check sensation. We want to test strength in all the different parts of the body. We look at all the cranial nerves, so everything from smell to how the eyes track from side to side, to facial sensation, to inner ear, like vestibular input, so how you look at a target and move your head and how your eyes are able to stay locked on that target, to tongue movement, to shoulder movement, etc. So all those cranial nerves are going to live down in the brainstem. Also, when observing the brainstem, we're going to be looking at all the primitive reflexes. So those primitive reflexes are a key part of our nervous system that gets us through that first year of life. After that first year, those primitive reflexes should be inhibited by higher cortical postural reflexes. So in any kid that we work with, we're going to make sure that we're checking all the primitive reflexes. If reflexes are retained, it's not causing a brain injury by any means, but the easiest way to describe it is rather think about your child learning how to ride a bike and he's mastered the skill, but he still has training wheels on the bike. He's still going to be able to perform well, but there's going to be something there that's holding him back from keeping on progressing. So we go through, we check all the primitive reflexes. We do a lot of eye movements. So we want to look at slow eye movements, how you track from side to side. We want to look at quick eye movements, how you go from one target to another. We want to make sure we look at them, in the horizontal plane, so side to side versus up and down, because side to side eye movements are going to be in a different part of the brain and brainstem compared to looking at movements going up and down. As we keep going through, we're going to be looking at how they feel their body, everything from vibration to light touch to joint position sense to how they're able to balance with their eyes closed. These are all different things that are going to feed into parts of the brain that become very valuable when setting up our treatment plans. Then we go through and look at a lot of cerebellar integration. So we look at how they're able to coordinate certain movements. So touching your nose, touching a finger, flipping your hands back and forth very quick, looking at rhythmic movement stuff. We look at cross-crawl mechanisms. This is something that seems very, very easy, but a lot of kiddos have a really hard time crossing midline, not only with bodily movements, but also with a lot of eye movements as well. We're going to be looking at different like retinotopic maps, so how they perceive certain objects within their visual field. Tonotopic maps, so that's going to be how they perceive different sounds in different fields. Somatic topic maps, so if I'm touching somewhere in their body, could they go through and touch the exact point that I'm touching? All of this stuff may seem like pretty trivial things, but when it comes to a functional neurologic exam, this is going to be the most key part that we're looking at, because this is really going to be the formulation of how we're going to proceed going forward. And we could go on and on about the exam as well. I mean, we even go as far as listening to the stomach, looking at how the palate's working. How the palate works is going to be a direct indication of how the vagus nerve is functioning. So the vagus nerve is the big nerve in the brain. It's cranial nerve 10, which goes down and innervates our autonomic nervous system. So everything from the heart to the stomach, etc. And with almost every kiddo I work with, there's going to be some form of vagal nerve dysfunction. And there's a lot of different cool modalities and cool therapies that we're able to do to help activate that vagus nerve. So the better the vagus nerve is functioning, the more of a parasympathetic state they're going to be in. So that's more of like a rest and digest versus a sympathetic state, which is more of a fight or flight. So kids are a little bit more anxious, things along those lines. And a lot of kids with autism, for example, have a hard time with their GI system, with their stomach. And we find that the big missing link in that whole complex is working on that vagus nerve, because a lot of kids I see, they've tried cutting out certain foods, they've tried all the different supplements that they've read online, and nothing's really helped their GI system. But when we start incorporating that brain-based component into it, that's when we start seeing some of our cooler changes.
So is there a specific age group that you work with, or could it be from babies till adults, or?
Yeah, so in my practice right now, I would say the youngest person I've worked with is probably 6 weeks old. Suffered a birth injury, so we're slowly starting to work through that. Obviously, therapies for a 6-week is going to be much different than a lot of the population, but we worked with as little as that. I mean, we worked with 6 months, 8 months. I would say the average age from a brain injury standpoint that people get into our clinic is around 2 to 3 years old, because what we do is not necessarily traditional path of a brain injury. So there's an awesome community out there of families whose children have suffered brain injuries, and they all come together and they share different resources and things that help them along their journey. But with more education and more awareness that's coming out about some of these alternative therapies, we're starting to see kids at a much earlier age, which is absolutely awesome for overall prognosis of the injury. So we work with little babies, and my oldest patient right now is 84 with Alzheimer's. So we kind of see a whole range of people here in the clinic. It's definitely going to be biased towards that younger side, but the cool thing about what we do and the equipment that we have is it could help a large population of different people.
So you work with adults too. So can you help people that have, let's say, MS or Parkinson's?
Yeah, so within our skill set, we definitely have the means to help some of these patients. We're quite selective of the adults that we take on, just because our practice isn't really adult centered. We work pretty closely with a couple other practices here in the Valley that quote unquote specialize a little bit more in adults, like Arizona Chiropractic Neurology Center with Dr. Berry and Dr. Teams. They're going to be more of a adult centered practice, and they're only 20-30 minutes away from me, and they're two of my good friends and my mentors that I started out with. So with a lot of adults that we either don't have the time or the equipment that we need to take on the cases, we have a pretty good repertoire of different doctors here in Arizona that we're able to co-manage cases with.
So what about teenagers, for example, or I mean, even kids that get anxiety, they have a lot of school anxiety or just anxiety about the world from everything that's been going on for the past few years and still going on. Is that something that you can help these kids with?
Yeah, so we definitely have some kids. I mean, this started at the beginning of COVID, unfortunately, where we've seen massive spikes of anxiety in a lot of these kids. And unfortunately, it's not always around the virus itself. I've seen more of a pattern around how the world's changing due to COVID, which is unfortunately devastating. That I hear 6 and 7-year-olds having to tell me they don't get how the world's changing and why they can't go certain places. Fortunately, things are slowly starting to make a change, but I think the 2 years that we've dealt with this crisis, unfortunately, will have an impact on a lot of kiddos. And we definitely are able to play a role within the the management of some of these kids. I've seen kids absolutely knock it out of the park with some of the things that we do. There's some cases which are quite possibly a little bit more severe that I feel comfortable co-managing, possibly with a therapist, with somebody who's a little bit more trained in psychological conditions where things may go a little bit past anxiety. I think I could play a role within that team, but I'm never going to say I want to be the only one working on your kid. There's with a lot of stuff, especially when things start to get a little bit more intense, a team-based approach, in my opinion, really is the best way to go, because if you're working within a whole team of experts, there's going to be people that know certain things that you don't, and you're able to share ideas with some pretty cool people and get some pretty good ideas, which lead to those good results. So when it comes to anxiety and some of the psychological disorders, I'd say yes, we can play a role in that. After I examine them, after we talk a little bit more, that's where we decide if there has to be some extra management within there to really maximize the benefit of treatment.
And what about if parents are listening and they have an autistic child? What does that look like? Is there any autistic child? It doesn't matter how severe their autism is. You can still help them, or does it have to be a mild case? Or
I mean, we've worked with everywhere from mild to very severe cases of autism, everything from verbal to nonverbal. And the results that we get, I think, are pretty awesome because of, not because I'm a self-renowned therapist by any means, but the therapies and the modalities that we have in our office, especially the laser, it's going to be one of the best possible things for autism. We have a study in the works through Erconia. They performed a study, I guess it's a couple of years ago at this point now, but it's passing through all the IRBs and some pretty cool journal entries. And they looked at the initial application of the laser and how they responded to that. And they looked at the ABC checklist. And from a basic 8-minute application of the laser to somebody's head, these kids with autism, their anxiety decreased, their behaviors improved, so on and so forth. And they actually did a year follow-up with that initial study. And everyone that received the Erconia laser still had those massive improvements. And the people who had the placebos, which in this case were LED, didn't have near the improvements as the Erconia group did. And they actually ended up treating the placebo, and they had the same results as the treated group did. So we know that the use of low-level laser therapy is going to be one of the most paramount things that we could do for autism, primarily from the implications that we could have on downregulating some of the inflammatory processes that happen and accompany autism. We could work on the gut with it. We could work on that vagus nerve that we talked about. We could work on the frontal lobe. We could work pretty much anywhere in the brain and apply that laser passively. And passively is an important thing to say as well, because sometimes with kids with autism, therapies could be a little bit challenging to get through due to compliance. So if we have the application of the laser, we're able to do some more passive therapies, which is possibly one of the most beneficial therapies that they could possibly get. So to answer your question, I think if I have a patient with autism, I always at least start out with a trial. Even if I'm not sure I'm going to take them on as a patient, I'll always start with laser and see how they respond to that, because what the research is telling us is that laser is going to be one of the most important possible therapies that you could do, and one of the most beneficial therapies you could do to mitigate some of the symptoms that intertwine with autism. One thing that a lot of people do forget about autism is the massive implications that diet has on working through some of the symptoms. This is something that I completely understand can be challenging due to a lot of their picky habits. but working through possibly some stool testing, some food sensitivity testing, basic labs, working on the whole GI system really seemed to go a very long way.
And if somebody is listening now thinking, wow, this sounds amazing, I want to take my child to see Dr. Bohr, do you have like a 5-minute free consultation or something to see if it's a good fit? Or
Yeah, so if you go to our website, it's neuroactivecenter.com. We have a form right on the front page where you could email in and we'll set up a free 15-minute consult. I think these are important because we have to make sure initially from the start that we're going to be a good fit for each other. And I get what I do is a little bit different than some of the traditional therapies, and it's important for parents to be educated about some of the differences that we may do in our office, how our therapies are a little bit different than your typical ABA therapy, OT, PT, speech, whatever it may be. And with that initial phone call, we're able to chat about some of those things. And I could definitely help parents get on a similar page to where I'm at. And ultimately, it's their decision if they want to move forward or not.
now you're in Phoenix, Arizona. What if somebody lives in New York and they want to take their child to see you? Is there a way that they could work with you?
Yes. Yeah, so every week we have a patient. Pretty much every week we have a patient from out of town in the office. We've worked with patients from many states. We've worked with patients that have flown in from the UK, from Africa, some pretty far places around. And what we do is we set up something called an intensive, where we work upwards of 14 to 15 hours a week, where we do the most important therapies and really activate the brain that the way that it needs to be activated in a little bit increased amount, so we could really drive the brain to start making some changes. And within a week, I mean, we'll see a kid 3 to 4 hours a day, and we're able to see some pretty awesome changes at the end of the week. Something that's important that I urge all parents to do is at the conclusion of that week, we put together a home care plan. The home care plan becomes pretty crucial when it comes to keeping those weak networks activated, because we could do all the amazing things that we want in the world on that intensive week, but if care kind of drops off after that, yeah, you may see some benefits, but you won't nearly see the benefits as if you if you followed up on all the home care plan recommendations. So yeah, our intensives are definitely one of our big parts of our practice, and it's something that we're incredibly blessed to be able to do and have parents put their trust into us to work with some of their kiddos. A lot of our pediatric brain injury parents pair up their trip with stem cell therapy. So one of the best people in the world, really, in pediatric regenerative medicine is right here in Surprise, Arizona. And so what we'll do is we'll pair up the intensive week of therapy with the stem cell. And the easiest way to describe it is the stem cell therapy is putting new neurons into the body. It's my job to help connect those neurons. So what we do works very well hand in hand with stem cell for a lot of these pediatric brain injuries. And we've been able to see some pretty remarkable changes within such a short period of time.
Yeah, it's quite amazing. And you're very centrally located in North Central Phoenix, about 15, 20 minutes from Phoenix International Airport. And Surprise is what, like half an hour, 40 minutes north?
Yeah, it's around 40 minutes. Yeah, so
Yeah.
we're right in the Biltmore area, so kind of smack dab in the middle of Phoenix. So we're able to be accessible to a lot of different areas within the valley.
Yeah, so very easy. You can very easily stay in between the two, and it's literally 15, 20 minutes to
Right.
each of your
Right.
practices.
Mhm.
So I want to thank you so much for being a guest today and sharing all your knowledge. And can you tell us again the name of your website? And I will also put that in the podcast notes.
Yeah, so the website is neuroactivecenter.com. I'd say to get the most up-to-date information is to follow us on Instagram. We don't post a ton, but we definitely keep up with posts there. We post different therapies that we're doing, some success stories, some educational information. So our Instagram will be a good place to kind of keep up with our practice if you're interested in learning some more about it.
And what's the Instagram name?
It's at Dr. Connor Bohr.
So I will put the Instagram and the website in the podcast notes as well. So
Awesome.
Thank you so much for being a guest today on Dr. Lotte Science with Soul. And I hope to have you back in the future as your clinic grows and keep sharing this knowledge, because it's so important to get this information out and letting parents know that there is help available.
Absolutely. Absolutely. I appreciate you having me on. Great talking to you as always.